Welcome to the Scale Tactics Podcast. I'm your host, Brian Sells, a former Army Ranger turned government tech executive and now small business founder, passionate about helping small to mid-sized businesses succeed. This podcast is designed to educate leaders on the different operating principles for small to mid-sized businesses. We'll discuss best practices and help leaders be more informed as they develop strategy to scale their operations. On today's episode, our guest is Jessica Dubois. Jessica is an employee benefits consultant for risk strategies based out of their DC area office. She helps employers design and manage high-quality, cost-effective benefits programs. Jessica specializes in self-funded health plans, HR technology, and employee communication. Some of her accolades include being named 2019 Face of Change by Benefits Pro, the 2020 Rising Star in Benefits by Employee Benefits Advisor, and Jessica was recognized as one of the 40 under 40 by the Northern Virginia Chamber of Commerce. I've personally worked with Jessica to rebuild our healthcare customer service and completely restructure our healthcare plan. We're able to maintain the same great coverages, but take advantage of our larger size and historical healthcare data to significantly reduce our overall healthcare costs. Jessica is really good at what she does. After working with multiple healthcare brokers, she hands down leaves them in the dust. I'm excited to share our conversation with you. On this episode, we talk about different healthcare plan structures and broker considerations for small to mid-sized businesses. To frame our conversation, healthcare plan structures are separated by the level of control and cost transparency that you have. Starting out as a business, you have limited options because of your small size and limited claims data that you have on your employees. But as you grow and have more years of this claims data, you can change how your healthcare plan is structured to save money while providing the same or better levels of benefits. This cost savings can be pretty significant considering benefits are one of the greatest overhead costs in a business. I hope you find our conversation today helpful, and our goal is you have a better understanding to go back to your healthcare broker and look at ways that you may be able to structure your benefits to achieve some cost savings or plan for future needs within your company. Ladies and gentlemen, this is a great one. But first, a quick word from our sponsor. This episode is sponsored by Victoso. Victoso is a technical recruiting team founded out of a frustration with high recruiting fees. They use a fixed price per hire model to significantly reduce recruiting costs and protect your budget. Founded by former tech leaders, they not only know recruiting, but have led engineering and product teams so they know how to find the best performers for your team. If you feel stuck with your current recruiting efforts or are ready to grow your team without breaking the bank, check them out at Victoso, victoso.io. And now, on to the episode. Jessica, welcome to the show. Thanks for coming in today.
Yeah, thanks for having me.
So, want to go ahead and just kick off healthcare broker. What is that? What are the services provided?
So in simple terms, it's a licensed professional that advises employers on employee benefits. Typical services is somewhat dependent on the size of company that they're working with or the size of the brokerage, but it's going to be consulting on employee benefits, compliance, many times benefit administration, enrollment services, and sometimes some different add-on services. Could be additional consulting or different types of insurance, such as business insurance, 401k, things like that.
Nice. And I know, of course, there's a ton of companies out there that offer a variety of services. How do you kind of see that separate between what some can provide versus what others may not be able to provide as well?
I think it comes down to, if you're an employer, it's what you're looking for. Typically, when you're a smaller size company looking for a benefits broker, you want someone, you care less about the consulting on healthcare and you care more about maybe all the other services, like what customer service support can you provide? What compliance assistance can you provide? Because many of those other services that are considered maybe more ancillary are things that you do not have in-house and that you need help with. Whereas as you get larger and healthcare costs tend to be a bigger part of your operating expense budget, you tend to care more about the healthcare consulting and the expertise on that side.
Yeah, I definitely agree. I think we saw that in my last company as well. As we span the growth in headcount, the needs change, where it started really on that customer service, and that really was what set apart different brokerages, as well as, you know, when we were ready to take on the restructuring, once we got our customer service right and got the enrollment worked out smoothly with all our new employees that were coming on. Like, I know you guys in particular are able to do for us risk analysis and risk profiling. Is that common with a lot of companies, or is that based on the size of the brokerage that some have that in-house versus some may have to like get that farmed out or not even able to do that?
Yeah, I think some has to do with the brokerage, some has to do with the advisor that you're working with. I think in the past, our industry has not really focused on the ability to save employers costs. It's been more about the ancillary services. And brokers have been paid great money to not really save employers money. Just to give you an example, I mean, typically commission for a broker in the past has been a percentage of premium. So as your premiums increase year over year, their paycheck increases year over year. That's a conflict of interest, which we can all see. We're seeing more of a movement to where there are brokers that are advising as more, financial consultants, and that is the direction I would say that definitely our brokerage goes. And I would say that we're seeing more brokers try to, I would say, lean that way.
Now, is that something in like the interview process when I'm trying to potentially look either with my current broker or looking at new brokers? Is that something that typically gets disclosed at the beginning, or how is that like fee structure, fee sharing work for understanding what the broker's getting and maybe how their interests are aligning?
It's definitely something you should ask about. And you actually did a great job of this. So of course, there's important questions like, what's our renewal process? What's our day-to-day team look like? How can you help us with compliance? But even more important than that, as you get bigger, there should be questions like, what does our long-term strategy look like over the next 3 to 5 years? What would that look like to you? That's the type of question you should ask your broker. Also, how are they being compensated? Is it per employee per month price or commission, or is it percentage of commission? And that should tell a lot about the broker. Also, another item would be asking about how, outside of healthcare, what are other ways for the broker to support the company. So they should be able to talk about benefits or lines of coverage that you didn't think about, that you should think of as a growing business.
You guys have a snapshot of what other companies are doing that you can kind of see, like, what is the typical best in breed benefits that are being offered by competitors to help like remain competitive for yourself for when you're trying to look at, how you structure your total compensation package, right?
Yeah. Like, what strategies have you seen work well for companies like us? I think that's a great question that you should be asking the potential broker.
So I want to dive into some of the healthcare structures, because there are several ways that a company can structure based on size, needs, etc. So really want to break it down to the most simple startup for a business. Like, when I'm first starting out, how many employees do I have to have when I can start rolling out my first healthcare plan to my team?
So you only need one W-2 employee outside of the owner. What I would say is that try to wait as long as you can. So if you have 3 employees and no one, healthcare is not important to them, maybe they're getting it through TRICARE or through their spouse, let them continue to do that. Because having a health plan does cost you money. It does require some administration. So you want to wait as long as possible, but understanding that most employers need to offer some type of benefits package in order to be competitive. So when that time comes, you just need that one W-2 employee, and it's going to be, in a fully insured plan.
Is there a legal requirement that at this headcount, I have to provide a healthcare plan to my team?
Yeah, so it's going to be at 50 employees is when you have to offer it.
You kind of mentioned with the first small employees trying to wait as long as possible, at least. Is that just to build size so you have more options, or, you're not locking in at a higher fixed cost to start? What's kind of the benefit of trying to increase the headcount slightly before you roll out your first plan?
Yeah, so my thoughts on that is to wait because it requires work and money. So as a small business, you're very limited in resources. Many times if you're under 10 employees, it's the CEO that is having to take on the task of the benefits. And so that's why I recommend trying to push that out just to give you more time, save you time and money. But you can start when you have one W-2 employee, and just keep in mind also that though it seems very unfair, once you're under, while you're under 50 employees and you're in a fully insured plan, which is what most companies under 50 would be in, your rates are typically age banded or community rated, which means the rates are very much based on the demographics within your company. So the age of the employees. So if you have 3 employees and you put in a health plan and those 3 employees are all over the age of 50, you're talking about some really high rates. But if on the other side, you hire a bunch of 30-year-olds, your rates are going to be a lot less. So just something to consider, not saying to discriminate at all, but just saying it's something to know about.
I think you bring up something we'll touch a little later is the overall risk profile and demographics and how that does impact your cost. On the last question on this persona of new business starting out, what needs to be the typical lead time to get some type of benefits plan in place?
You're really not going to be able to look at rates or choose plans until 90 days out. And I'm more or less talking about smaller companies, because typically if you don't have a health plan at all, you're going to be a small organization. So 90 days out would be ideal for a startup company that is looking to add on healthcare.
And what's probably the fastest, this thing hit, I'm ready to go? What's probably the fastest so you could get something in place?
I would say 2 weeks. Some of it's dependent on the carrier. So some carriers will accept paperwork even after the effective date. But most of them require at least 15 days of lead time.
And at that point, I need to have at least a demographic pool, right? I can't just say I need a healthcare plan. They're going to want some type of profile of what my population is going to be. And it can't be a guesstimate, I imagine, right?
Yeah. And actually, as part of the paperwork, carriers typically require a wage and tax report or a payroll report. So this is something I find that most startup companies don't realize that they need. They need to provide some proof of business or maybe articles of incorporation, some type of, like I said, payroll report that shows 2 weeks of payroll, that these are actually legitimate employees that are working full time. Those would all be required to start the medical plan.
So definitely something as you're bringing on your team to have that conversation of, hey, we're getting healthcare. It's coming very quickly, but there's probably going to be a 30-day period that we need to look at alternate coverage options as we get something started.
Yes, this is a question I get from a lot of startups where maybe someone just started their business and they're like, okay, hey, in order to hire employees, I need a health plan. But I can't get a health plan without having employees. That's the problem. So for those types of employers, I recommend having some type of plan for that person that you are maybe interviewing and see what their healthcare needs are. Many times, if they're currently employed, they can remain on their current employer's plan through COBRA, and maybe you help subsidize some of that cost, or maybe for a month you provide them some type of dollar amount that they can use to go purchase an individual plan off of healthcare.gov. Then while they're working for you for that first month, you go ahead and you get a plan in place. The second thing I'll note about that is most employers also have some type of waiting period, whether it be first of month following date of hire or 30-day waiting period. By having some type of waiting period like that allows you enough time to get the health plan in place.
That's a great point, the COBRA, and, providing a subsidy for if you're trying to reach out, definitely part of the conversation for benefits, hey, this is where we're trying to go for 30 days or 45 days as we get this set up. We're going to provide you a reimbursement of your COBRA, and maybe you cap it.
Yep, but be careful about that, because you don't ever know what that current employer it has for a plan. So before you make any promises, I recommend taking a look at that and knowing those rates. I've seen, I'm working with a large 500-600 person client right now, and they've had some high claims. So they have really high rates that go well above like a single rate goes up above $900, which is outrageous. Wow. So you just want to make sure that you are, careful about making promises. You want them to be, you don't want your new business to go down because of healthcare costs.
Yeah. I think that's a great time to pivot to, the different health plan structures that are out there. And I'm going to throw this up on the screen. And for those listening, this will be in the show notes. Those watching on YouTube, of course, you can see it here. This is from Jessica. It shows the different levels based on risk, cost, and headcount that you have available. So if we can start, just on the left and briefly go left to right on like what each one is and kind of the quick highlights. So first one up I see is PEO, Professional Employer Organization. What is that? What does it do?
Yeah, so the PEO is a way that you can kind of get that all-in-one package. So if you want to get your employee benefits, payroll technology, many times 401k, business insurance, all in one, click the easy button. PEO is going to be the way to go. With the PEO, you're going to be a little bit limited, as in your choices of health plan carriers and health plans are limited to what that PEO offers. So I've seen employers in a PEO get a 30% increase. They can't do anything about it because they're just kind of limited to what that PEO is giving them. You can't go out to market and shop all of your plans. Maybe that PEO offers different medical carriers. That's really what you're limited to. The PEO is taking on all the risk. So they're taking on all the risk of the health plan. They're the fiduciary of the plan. So some employers like that. Bad news is they also keep all the reward. If any premiums that you pay them every single month, you're not getting anything back. You're likely getting an increase next year. You have no control over the situation. The last thing I'll note about PEO, there's many different options out there. There's ADP Total Source, Rippling, Just Works. I recommend working with a broker to help you narrow down your options, to advise you on what PEO makes sense. You do not want to work with salespeople at the different PEO organizations. So you want to have someone be a third party to help you, narrow down those decisions.
Now, would that service cost anything to go to a broker? Because ideally, they're going to want you to come to their brokerage, right? Is that something they typically do for free?
Yeah, so many times the PEOs will pay out some type of commission to a broker for a referral, or will allow the broker to come in and still work with the group within the PEO. It doesn't typically cost the employer any more to work with a broker and to help refer them to a PEO, but it basically takes some of the commission from the PEO and gives it to the broker.
And I think like one of the comments to help frame this whole conversation is kind of risk and cost as we're talking about this. So from the very basics of a healthcare plan, right, we have, ultimately it comes down to claims, and that whatever plan you're on, they're setting a cost based on what they think your risk and expected healthcare plan spend is going to be, right?
Yep, correct.
That pegged number that we had, underspend, of course, we want to keep that cash ideally as we get farther to the right of this scale, but overspend, it's who's laying the risk of that overspend, correct? Is that a fair characterization?
Yep. The only thing I would add is that by transferring that risk, so you'll see from the left-hand side, like it's basically you're transferring the risk over to someone else, whereas on the right-hand side with the self-funded plan, you are taking on the risk as a company. To transfer the risk, it's the most expensive. So it sounds great to transfer the risk, but just note you're overpaying to transfer the risk.
Yeah, because ultimately the PEO or the fully insured, they don't want to be paying out of pocket for your overspend. So they're going to try to peg that higher to protect them, right? Or at least paying for insurance to cover you.
Yep, exactly.
So PEO, obviously a different from a broker. A broker may be involved. At what point do we go to a healthcare broker? Is that when fully insured kicks in, or is that still working through somebody else?
Yeah. So as a small employer, maybe you're starting up your plan, you can decide between going to a PEO or working just with a broker and doing a fully insured, typical medical plan.
What is fully insured for a healthcare plan?
Yes. So you are paying premiums to the insurance carrier every single month, and they're taking on the risk of claims and they're administering the claims. They're typically in a fully insured plan. They're providing the network. They're managing pharmacy. All the components of the health plan are managed by the insurance carrier.
Okay. And, and that's like an Aetna, right? You're going direct with Aetna or Blue Cross Blue Shield. And so under a PEO, you're kind of like, they've already done the legwork and you're just kind of getting what the offering is, versus as you start moving into fully insured, you're taking on with the broker some of the legwork of, okay, let's now go start looking at the whole marketplace and what's available.
Yes. Yep, exactly. And PEOs will often tout lower medical rates, and that is often the case, but you will get lower medical rates within a PEO generally. However, you will end up paying extra on some of the other, admin fees and just the fees of being with the PEO, which could be a percentage of payroll that you pay them every month for a fee, or it could be a per employee per year number. It just varies by PEO.
So now we got fully insured with an HRA. What does that add on there?
Fully insured. So this is the same thing that we just talked about, except you have a high deductible. So a high deductible could be, let's say, like $1,500 or above, and you are adding in an HRA or health reimbursement account. Now, this is a step to the right because you as an employer are funding the HRA. So you're funding the deductible. So let's say the deductible is $1,500. You are providing an HRA of $1,500 that really feels like a $0 deductible to the employee, and you are taking on the risk of the $1,500. The employee will typically get a card or they'll get access to an account where they can upload their claims or use the card to spend. And those dollars that they spend will be taken out of the HRA. The goal is to, as an employer, by having the HRA, is to have the employees not spend as much as what the HRA is for. So if the deductible is $1,500 and you're taking on that liability, typical utilization would be closer to like a 60%, and you basically get to retain the rest of those dollars. So we often see employers who maybe you want a $3,000 deductible for your plan and you want an HRA to cover the first $1,500 of the deductible. You can really customize how much you want to provide as reimbursement under the HRA.
So really there with the HRA, instead of on the fully insured where like, hey, I may be trying to have a lower deductible to help out my team, for healthcare costs, I'm keeping it transparent, but trying to take advantage of the fact that, hey, a lot of my team is probably healthy and isn't going to the doctor that often. So the extra premium that we were paying for this low deductible, we're actually saving because we're only kind of paying the deductible as it happens, right?
Yep. Or another way to look at it too is maybe you typically in a employer, 5%, 10% of the population makes up a majority of the claims costs. So maybe we know that 5% will meet the deductible or, fully utilize the HRA, where the rest of the company will not, or spend just a small portion of it. You end up saving a lot of money by having that HRA in place rather than, paying for a lower deductible for everyone.
And now, so moving on, level funded. What is that one?
Yes. So level funded is technically a self-insured plan. It's becoming more and more popular in the marketplace because as employers want more transparency in their health plan and what they're spending and claims. And there's some attractive components to it. So with a level funded plan, I put over 25 employees as typical size, but we see some carriers like United Healthcare even offering level funded plan options to groups over 10 employees. So it's called level funded because every month you're paying premiums just like you do under fully insured. So 4-tier premiums usually. So employee rate, employee spouse, employee child, and then family rate. They give you the leveled premiums and those stay the same for the 12 months. Now those dollars go to the carrier, and then the carrier utilizes those dollars for a claims bucket and then fixed costs bucket. And so every single month, you should have access to a report that shows you, okay, this is how much you're spending compared to what we expected you to spend. So this is how much you're spending compared to what premiums you're paying every single month. And at the end of the year, if you haven't spent all the money that they think you will spend in the claims bucket, you will receive, typically it's half of the savings or 2/3 of the savings back. Caveat is that in order to receive those savings back, you usually have to renew with that carrier. So if you switch carriers the next year because you got an increase or you don't like that carrier, then you do not get that money back. You do not get to retain those savings. A lot of brokers will say it's like a bridge to a self-funded plan because you get access to some of the data, you get an opportunity to get money back, but you don't have to take on the risk of if you overspend. Like if you overspend your claims budget by 25%, that's still the responsibility of the carrier. You'll get a high increase, but it's still on the responsibility of the carrier.
So really, this is kind of the first pivot that as a business, I'd imagine you'd want to try to get to, right? Because at that point, you can start getting some money back on your plan, or...
I have mixed feelings about level funding. I think it depends on what access you have to data. So if as a fully insured group. So if you're fully insured and you're over 100 employees, you likely have access to some data. If you're under 100 employees, you may have access to some data depending on what state you're in and what carrier. There's ways that you can get access to data. Like there's different tools that you can utilize, or you can have employees fill out questionnaires, things like that. If you do not have access to any claims data, you do not know if there's any really high costs or claimants or chronic conditions, then level funding could be a good bridge because then that gives you access to some data to help you move more to the self-funded market. But if you have access to that data, most of the time I'm recommending you skip over it. And the reason why is because you end up overpaying a lot for fixed costs. So when I say that your premiums are level funded every single month and you're just paying the same thing, a majority of those premiums, some of it's going towards claims, but too much of it is going toward fixed costs like stop loss and profit and admin fees to the carrier, where it would make more sense to just move over to the one of the next self-funded options and just pay less for that structure.
Gotcha. So now kind of moving over as we start getting into this self-funded, first one being the ASO there. What is that one, and what are some of the benefits of moving into the self-funded realm? So
we call it alternate funded many times because you're technically not self-funded. When you think of the word self-funded, you think of you are self-funding all of your claims costs. And most companies are not actually self-funded. Typically, there's a layer of insurance that helps with any large claimants. And so that's why we call it alternate funded. But this is, in this case, I put bundled with one carrier. So this would be like going from fully insured with United Healthcare to moving to their self-funded plans where you actually are self-funded with them. Maybe you're utilizing their United Healthcare network, their stop loss, their pharmacy benefit manager, Optum, but you are actually funding your claims. And by self-funded, basically you have a budget that you've hopefully created with your broker that shows, okay, this is how much every single month we expect claims to be at and the maximum amount claims could be at. And every single month or on a weekly basis, depending on the structure, is when those claims will be pulled from that account. Your fixed costs you're paying every single month to United Healthcare, whoever the carrier is. And any money left over in your health fund account that you own, that's your bank account, you get to retain at the end of the year. So less claims, you get to keep any leftover dollars.
Yeah, and this is where y'all were super helpful. So my last company, we brought on Jessica when we were switching from level funded and taking the jump into self-funded. And really, as she said, that's the big thing. On the surface, you're still just paying a flat fee every month. But the difference being like that flat fee is essentially you're funding your budget. If it's not spent, you get to keep it back. So, and that's where the data matters, as she was talking about, because you have to have that data to be able to do the risk profile, to forecast your plan spend, and to get the stop loss insurance. Because that's the big thing is like, what happens if I have a really bad year on healthcare? And you can buy insurance that will, at a certain amount, step in and cover that delta if you go over. So I think that's kind of the three major costs, if you will, within the self-funded is your claims, your fixed cost for like the different people that are just administrating and all the staff it takes to administrate the plan, and then your risk insurance, right?
Exactly. And in this model, you're still kind of overpaying for those admin fees by having it all bundled with one carrier. But administratively, it tends to be a little bit easier because, again, you're just working with one carrier or vendor.
Yeah, because there's a little bit more back office add here because you are having to set up your bank account. I mean, that's what we had to do. We had to set up our healthcare bank account, make sure that we had the battle rhythm each month to get those claims ferried over. And you need to really have that time monthly that you're sitting down with your broker and doing the claims analysis, because that's where you're going to achieve that cost savings, is getting that data, seeing where your healthcare spend is, because there are some options, right? If I've got somebody that needs a very expensive drug, there may be options that you can come in and look at alternative pharmacies or something like that. They could potentially get it a little cheaper, as a good example of a way to buy down your cost once you have that transparency.
Exactly. But when you're bundled with one carrier, generally your contract with the carrier will not allow you to do some of those additional solutions. The only solutions you'll have access to are the ones that they offer, unless you create some type of contract amendment with them that allows you to go outside of their solutions.
Oh, so inadvertent great segue then over to the next one, right? For group captive.
Yes.
More options.
Yes. So with a group captive, you're basically sharing in the stop loss risk. So you're talking about risk insurance. You're basically sharing that risk with, could be dozens or hundreds, could be even thousands of other organizations. So the way the group captive works is that you have the amount that you're responsible for. So the claims, that's the part the company's responsible for. Then any high claimants, there's a layer in there that is shared with the captive. And then there's a layer above that is your risk insurance or your stop loss. So it adds in an extra layer. The reason why I like captives is it's great for more mid-sized companies because you're sharing the risk with many other companies. It means that, if you have a bad year, it's not as bad, because that captive helps level out renewals. If you have a really good year, that means maybe you're not receiving all of the reward. Other people are benefiting off of that, but usually you're still, winning in the end.
So really their group captive there is, as with anything in insurance, if I go over or I have to use my insurance, my fees are going to go up. So with the captive, you're essentially paying to have this extra cushion at a more affordable rate, that if I go over this year, I have this cushion before my stop loss insurance kicks in. So I'm preventing myself, kind of hedging really bad fees going up the next year because of a one bad year.
Yep. And the captive structure will generally still provide you the flexibility to unbundle the different components of your health plan. So if you want to work with a carrier, like if you want to work with United Healthcare still and be in the group captive, you can. If you want to work with Meritain, which is owned by Aetna, then you can. But typically the best solution to save the most money is going to be by completely unbundling that and working with third-party administrator that's helping helping with the claims, a network, a pharmacy benefit manager, and then some RX, different types of point solutions. You can have that flexibility to do that unbundling in a captive, or you can, like I said, bundle it with a carrier, just like the last solution we talked about.
Yeah, and this is where we went to as well. And what we saw, going into the next plan year was by going into the self-funded group captive from level funded, and by decoupling all that, we were looking at, I know on the ancillary dental, vision, life, we were at like a 22-23% cost savings, and then a forecasted 10 to 12% unless we just had a really, really bad year. And even then it was still going to be break even essentially at our level funded. So, really no downside there. And if you think, sometimes the second largest, expense could be your healthcare plan. So, you're talking 10, 15% with all that bundled together on $1 million+ dollars. That's, pretty significant cost savings, but it's all tied to your ability to have that data and that track record, right?
Exactly.
And what's the last one we have here?
Yeah, so the last one is very similar to the last to the captive, except instead of having that captive layer or sharing, this some of the risk with other companies, it's all on you. So you work with a separate stop loss carrier. But the great news about this one is that you can shop different stop loss carriers. So like how you're used to in a fully insured plan, you shop different carriers every single year. Within a self-funded plan, you really only have to shop different components that as they make sense. So maybe your stop loss insurance goes up by 15% and you want to shop that out. You can do that and you have the freedom and flexibility in this final option.
And I think really the last thing that I'd say when structuring these just for planning considerations is as you move right, all these as you're starting to unbundle, that's different agreements. So, because you're going with different carriers, that is, you're going to be dealing potentially with anywhere from, I think we were at 4 different carriers when we unbundled, which again, not significant, but at the same time, it is a little bit more on the back office. Now that we have all these plan structures, I think we've really highlighted like, hey, get with your broker, talk with them. It's really going to come down to what does your population look like? What is your track record of data so you can make a decision? And would you say those are kind of the 2 drivers?
Yeah. So you kind of mentioned it. I would say your back office support, so administration. If you are the person, if you're the CEO and you're the person who's also acting as the HR ops person and you're also the CFO, it's going to be tough. You really need someone in your company that can help administer the plan, maybe review claims data with the broker every single month. You need to have someone that can be active in the plan, or be able to outsource that. So maybe you have an outsourced CFO or an outsourced controller HR team that can help support you.
How far out, if I'm wanting to restructure as a company, should I start looking to engage brokers and go through this journey?
Yeah, so I recommend the off season. So as early as possible, definitely 6 months beforehand is when you can, I would recommend probably have a broker chosen by then. You can always, wait till 3 months before, but it's going to be tough. And they're probably not going to be able to provide their best work because they will have less time. They'll be crunched. So as much time as possible. The other thing I'll note is that you want to give the broker time to have familiarity on a monthly basis of what your claims looks like. So every single month, at least every month, there should be, especially if you're in level funded or past that, there's going to be data that they can review. You want to give them time to be familiar with it and to build that relationship with you to help you understand how your plan is performing and what how they could improve it moving forward.
That makes sense. And I think so when we went through the process, we had to switch brokers just because our previous one, we were having some pretty significant customer service issues. And then we wanted to restructure. And I would say, I think we started the 5 to 6 month mark out is when we did the broker transition. I think at the 4 month mark out is when you guys fully came in the seat. We had spent 30, 45 days kind of talking through very deliberately what that transition looked like. And I think that worked well. And I think we really started about 4 months out from our plan, looking to go from level to self-funded into the group captive. And I think that worked very well timeline wise. I think we were busy and we were moving. The limiting factor for us was really when the insurance is, and just something to, I think was a great consideration is when is the insurance company going to actually release your renewal? Because the problem we ran into, we couldn't shop around for new ones until we had our renewal data, correct? Or our renewal rates from our current vendor.
Yeah, we were able to shop, but we were able to get the final, they were basically all kind of fake rates until, or illustrative rates until we actually had that renewal in hand. But your broker should be able to push for that renewal as much as they can.
Yeah, and y'all did a great job pushing. 4 months was definitely the sweet spot if you're looking to change, just to give you enough time where you were moving, but I still didn't feel completely uncomfortable moving through it. I think 3 months out would have been doable, but yeah, as you said, definitely probably the line in the sand not to move through because there's a lot of moving pieces when you're trying to restructure. But ultimately for the long term, I think it it helped us out with the most sense, just because, we're really looking at where do we need to be 3 to 5 years in the future. And that, helps lay the groundwork based on your healthcare structure. Open enrollment. So that, kind of the second big one, if I don't want to change my plan structure, or maybe just making minor changes to the band I'm already in, about how far out should I be engaging a broker?
Your renewal process should start, though, 90 to 120 days out if you're a small group.
Only other thing I think we haven't touched is compliance and some of the considerations. Affordable Care Act put some things in place, and, just general, the multiple labor laws that both at the state and federal level. What are some of the considerations that as a business we need to take into account when it comes to healthcare?
So my best piece of advice would be to have support helping you keep up with compliance. So on a calendar year basis, but also that can help you audit every single year. And the reason why is because there's so many new state and federal laws every single year. Like right now, we're helping a lot of people with the CAA and reporting on that end. But your compliance requirements are all based off of where you have employees, how many employees you have, what type of structure your plan is. So fully insured versus self-funded have different compliance requirements. And so you really need someone or tools that can help you keep up with those requirements throughout the year, because they all have different due dates as well.
Yeah, I think that's a great point. Like, as you're interviewing brokers, either whether you're current broker or if you're looking to switch, definitely something to ping. Because usually they'll reach out, but scheduling that and requesting those services is always super helpful, because they have the checklist, they have the subject matter expertise, especially in a small business where, like, depending where you're at in your people officer journey and how big that staff is, having that outsourced subject matter expertise can be very helpful. They'll come in, hey, do you have this doc? Do you have this doc? Okay, let's gen it up for you real quick. Let's get it on your portal or wherever you need to go. And it's pretty easy to schedule, whether that's, a quarterly or a semi-annual, going through and just getting that checkup. That is some great services that a broker can offer to help keep you square. So, well, Jessica, I appreciate you coming on. Super helpful. Again, healthcare is one thing. People taking care of people is huge, and the Maslow's basic hierarchy of needs to be filled. So healthcare plans are definitely a big component of that. And you can have the best one on paper, but if it isn't administered well or executed well, that's an easy way to lose the trust and confidence of your team. Appreciate the time today. And it's always great to see you. And for those who may be looking for a new healthcare broker, Risk Strategies, take a look. Jessica Dubois and team. She's based out of the Northern Virginia area. We were super happy. She came highly recommended, and they crushed it for us. So thanks, Jessica.
Thank you so much.
Thanks for listening to our episode today. I'm super excited to share my conversation with Jessica and hope it provided some great insights into healthcare structures and working with your benefits broker. I would love to keep creating and sharing this kind of content with you. If you can help me out, please like/review this podcast, hopefully 5 stars, and share with one person in your network who you think would enjoy it. Our goal is to release episodes every 2 weeks, so stay tuned for our next episode where I meet with Sarah Burt and we talk copywriting strategies for your company. Until next time, happy scaling.